Hi guys. So today we are going to cover this topic, which is fetal circulation. So in this topic we have shunts, three important shunts, in which the first one is ductus venosus, and then we have foramen ovale, ductus arteriosus. So if we read the text like this, like the blood from umbilical vein, it goes to inferior vena cava via ductus venosus. This would be very simple and like very reading like. Then we have then I draw the diagram to comprehend this very easily. So what happened that before birth we have placenta. We already know we have placenta. This is placenta, and in this placenta we have blood. So this placenta have umbilical vein. UV means umbilical vein. So this placenta will going to transmit the blood from umbilical vein to inferior vena cava by ductus venosus. This is the first shunt. Okay, so inferior vena cava, we have heard this term so many times, right? So if we see this arrow, it is showing or indicating toward heart. This little green portion is the heart. So this inferior vena cava is right there. So this inferior vena cava, now blood from placenta, it moves from umbilical vein to the inferior vena cava by ductus venosus. Now this inferior vena cava blood, it has oxygenated blood. So we have to keep this thing in our mind that we are talking about a heart or the circulation of fetus before birth, sorry. Okay, so inferior vena cava, it has oxygenated blood. So normally what happened that if this is a right side, okay, so it right side is deoxygenated blood, but in fetus it's different. It's totally opposite. So this inferior vena cava will going to transmit the blood to right atrium. This is very normal. This also happened in adults too. So in this inferior vena cava drains its blood to right atrium, but we see a hole here, which is foramen ovale. FO means foramen ovale. So now this inferior vena cava has option to go this from right side to left side from via foramen ovale. Now what happened is blood will gonna go to the left side from right side, and now this blood from left atrium will gonna transmit to the right atrium, and right atrium has what? Aorta. This is aorta. And now this aorta will going to transmit its blood to brain, to heart, to body, and this blood is oxygenated blood. And now if we talk about deoxygenated blood, how it would be. So as you guys can see here, the superior vena cava, SVC means superior vena cava. The superior vena cava is getting blood which is deoxygenated blood. So this deoxygenated blood will gonna go to the right atrium, and from right atrium blood gonna go to the right ventricle. If we see this hole, which is a foramen ovale, this will gonna close for like very few seconds, just because of the fact that blood want to go to his right ventricle. And from right ventricle, the blood gonna go to the pulmonary artery. And now we know that pulmonary artery normally it go to lungs, but here in fetus before birth, what happened that lungs are very underdeveloped. So lungs function is not that prominent. Lung will be closed for a while. After birth, it will be active. So now this lungs is not that active, so pulmonary artery blood will gonna go to this aorta by ductus arteriosus. You remember we were talking about shunts, so we had this shunt for ductus venosus, the first shunt, and the second shunt was foramen ovale, and third shunt is this ductus arteriosus. Now what happened is in this ductus arteriosus, blood will gonna go from pulmonary artery to aorta, and now aorta will going to transmit blood to the brain, into the heart, to the body. This blood will be deoxygenated blood. You have to keep this thing in mind. So this is what the diagram is. We discussed three shunts, which was ductus venosus, which transmitted blood from umbilical vein to the inferior vena cava, and this blood was oxygenated blood. Very good. And the second thing is, second shunt is foramen ovale, and third shunt is ductus arteriosus. So if we talk about first stage, it will be very simple for us to comprehend and to understand. So this is fetal circulation, and there's three shunts talking about. The first shunt is ductus venosus. This shunt, it help blood transmit from umbilical vein to inferior vena cava. Umbilical vein, this vein is coming from placenta. And now the second point is saying that most of the highly oxygenated blood from inferior vena cava, it goes to left atrium by from an oil. So this oxygenated blood from inferior vena cava will gonna go to the left atrium by from an oil. And the third point is saying that deoxygenated blood from superior vena cava, we're going to go to the right atrium and then right ventricle, pulmonary artery, and then it's going to go to the ductus arteriosus, because this ductus arteriosus, it help to connect pulmonary artery and aorta. So it will be very easy, this connection, because pulmonary artery resistance is very high. That's why this pulmonary artery will not going to go to the lungs. So at birth, infant take a breath. Yes, at birth when baby cries, it takes a breath. So the resistance of pulmonary artery decreases. It means that now lungs are active. Now lungs can function. So what happened, that left atrium pressure increases. What happen in fetus, that right atrium pressure is high than left atrium pressure, but when baby takes breathe, the left atrium pressure goes high. Now this foramen ovale will gonna close also. Now this, when foramen ovale closes, this is called fossa ovalis. So there's highly, when baby takes breathe, so of course the baby is taking oxygen. And then the prostaglandin, which is what prostaglandin is hormone. So it decreases because the placenta is separated from mother, and it's separated from the baby actually. Placenta is out. Now placenta don't have any connection with the mother and the baby. So prostaglandin hormone will gonna get decreased. And this ductus arteriosus, you remember ductus arteriosus? Ductus arteriosus is here. It connected pulmonary artery to aorta. This ductus arteriosus will gonna get closed just because of the fact that prostaglandin got low, because placenta was detached from mother and baby. That's why ductus prostaglandin got low, ductus arteriosus closed. Now this connection will separate. Pulmonary artery and aorta will going to do its own function. Now they will not be connected. Okay, so it is exactly what is said, that decrease in prostaglandin from placenta separation, and there will be closure of ductus arteriosus. And now, as you can see, there is NSAID. Do you know this acronym? The full form of this, it means that non-steroid anti-inflammatory diseases. Example: indomethacin, ibuprofen, or acetaminophen. It helps patent ductus arteriosus to get close. So when we see patent ductus arteriosus, it means that when this ductus arteriosus don't get close, there will be connection there even after birth. That is called patent ductus arteriosus. So patent ductus arteriosus is this term. Now these are the medications: indomethacin and ibuprofen and acetaminophen. Sorry. So indomethacin, ibuprofen, and acetaminophen. So these three drugs, it will gonna close this patent ductus arteriosus, because after birth we need this thing to get close. Ductus arteriosus, we need it to get close, just because of the fact that we don't want this mixed blood to get into the body. Okay, now we're gonna move forward. When ductus arteriosus get closed, when this ductus arteriosus get closed, the remnant will be there, which is called as ligamentum arteriosus. Now here it is it has given that thing that we remember it. Endomycin, it ends the what, PDA, patent ductus arteriosus. PDA, patent ductus arteriosus, endomycin. Okay, and then now prostaglandin E1 and E2 keeps PDA open. Patent ductus arteriosus, it get opened by prostaglandin hormone. After birth, prostaglandin hormone get low and placenta get detached from mother, and there will be closure of ductus arteriosus because there's no placental attachment from mother to child after birth. So this hormone will gonna get low and it will gonna cause ductus arteriosus to close. So this is exactly the diagram. If we just minimize the size, we can see it from diagram. This is a beautiful diagram. You can understand it from here. So here ends our fetal circulation topic. But let's just review this again. This was the diagram that I made. This diagram is very simple. That this placenta, it has umbilical vein which will gonna help blood to transfer to the inferior vena cava by ductus venosus. The first shunt was ductus venosus. Now inferior vena cava is in the heart. The inferior vena cava is at the heart and it carries the oxygenated blood. And now oxygenated blood will gonna go to the left, right, from right atrium to left atrium by from an OL. This is a second shunt. And now from left atrium, the blood will gonna go to the left ventricle. From there, the blood will gonna go to the aorta, and from there, the blood will gonna go to the brain and heart. And superior vena cava carries deoxygenated blood, and it goes to the right atrium. From right atrium, right ventricle, pulmonary aorta, because pulmonary hypertension is so high that it will this blood will not gonna go to the lungs, and also lungs are not that active and is underactive. So the blood will gonna go to the from pulmonary artery, the blood will gonna go to the aorta by ductus arteriosus. If this ductus arteriosus remain open, patent ductus arteriosus can happen, and the remnant of this ductus arteriosus is called ligamentum arteriosum, and this is the third shunt. First shunt, second shunt, and third shunt. And here ends our topic of fetal circulation of first aid, cardiovascular embryology. Thank you.